The high cost of the drugs is a major challenge for us as a society. Factoring in that value is a really important part of the equation of evaluating the cost of immunotherapy. Realizing when an immunotherapy intervention is likely not working, recognizing the difference between true progression and pseudo-progression, where you treat beyond progression, is really critical to effectively managing the cost of immunotherapy. And then finally, patient selection is really critical. So applying immunotherapy to the most appropriate patients by virtue of a biomarker or performance status, for example, is really critical to maximizing the value of immunotherapy.
Our concerns about immunotherapy are if patients can afford immunotherapy, if patients can access immunotherapy. So we really want to make sure that policies keep up with the innovations that are happening in the therapy world. And, with things like CAR T coming down the pike, it becomes even more important that we really want to see this happen for everyone across the country, no matter how much money they make, no matter their skin color, and no matter if they're receiving treatment in the community or in a hospital setting.
Financial toxicity is a huge concern for patients. I think it's really important that we've started labeling it as a toxicity, because it is really important, as it has as much of an impact on patients as some of the physical toxicities when they can't afford to pay for their treatments, or they really, they worry, is it worth this? Or should I save the money for my children's college? Or should I be liquidating my 401k for this? So it's something that's very top of mind for a lot of patients, and I think one of the keys is that we have to be able to talk to patients about it. They don't know how much things are going to cost, and a lot of times they're reluctant to talk about it with their physician. They don't want their treatment choices to be limited by what they can afford. And sometimes they're afraid to even say, I have a concern about this. So I think sometimes it has to come from the care team, and it could be various members of the care team, but to ask, do you have a concern about how you're going to pay for your care? Because there are options for patients, but they're often reluctant to bring that up.
I'm proud to be involved with the Institute for Clinical Immuno-Oncology, which is an institute of ACCC. I think it's really important because ACCC represents community cancer centers. And as we're seeing these more innovative treatments, whether it's immuno-oncology or CAR T or whatever's coming down the pike, we really need to remember patients in the community. We want to know that patients in rural communities, patients in communities across the country have access to these therapies.